Australia is currently experiencing a concerning resurgence of measles infections, with confirmed cases in 2025 already nearing the total for all of 2024. The sharp rise is being linked to two major factors: incomplete vaccination coverage in older generations and a drop in overall immunization rates since the COVID-19 pandemic. Many individuals in their 30s and 40s only received one dose of the measles vaccine during childhood, when 2 doses are necessary for complete protection. Additionally, vaccination delays during the pandemic created immunity gaps, particularly among children who missed routine healthcare visits. Health authorities are strongly urging anyone traveling internationally, especially over the Easter holidays, to confirm their measles vaccination status. Measles is one of the most contagious viruses known, and even a small number of unvaccinated individuals can rapidly contribute to widespread transmission. The country is increasing surveillance, ramping up public awareness campaigns, and offering free vaccinations in key regions to prevent a national outbreak. Meanwhile, in Europe and parts of North America, scientists and epidemiologists are closely monitoring the spread of Mpox, formerly known as monkeypox. The virus, which caused a global concern in recent years, has shown signs of resurgence, with clusters of cases being reported and new mutations observed. What's particularly worrying to researchers is the virus's continued adaptation to human hosts. Mpox is no longer confined to zoonotic spillovers. It has demonstrated sustained human-to-human transmission, especially in close contact settings. In some communities, particularly among men who have sex with men, transmission has become more entrenched, leading experts to consider this virus as a potential future global health threat. Although most cases remain mild, complications can occur, and the risk of further mutation remains high. There is an urgent call for better diagnostic infrastructure, wider access to antiviral treatments, and expanded vaccine deployment, not just during outbreaks but as a part of proactive health strategy. Experts emphasize that ignoring Mpox today could lead to a much bigger crisis tomorrow. In the realm of gastrointestinal viruses, Norovirus has once again made headlines, this time affecting passengers aboard an international cruise ship. More than 200 people, including both travelers and crew members, experienced severe vomiting, diarrhea, and dehydration during a voyage that departed from England and was en route to the Caribbean. Norovirus is extremely contagious and known to spread rapidly in close contact environments like ships, schools, and hospitals. Its persistence on surfaces and resistance to common disinfectants make it particularly difficult to contain. While most recover without long-term effects, the virus can be dangerous for the elderly and immunocompromised. This outbreak underscores the ongoing need for rigorous hygiene protocols in the travel industry, including better ventilation, isolation procedures, and rapid response systems to manage contagious diseases on board. With cruise travel returning to pre-pandemic levels, vigilance against pathogens like norovirus remains a key priority for international travel safety. In Eastern Europe, an unsettling respiratory outbreak has gripped public attention. A mysterious illness characterized by high fever, persistent coughing, and in some cases, coughing up blood, has spread rapidly through multiple Russian regions. Reports indicate that patients are experiencing unusually long recovery periods, often over 10 days of intense symptoms that leave them completely bedridden. Health officials have not confirmed the exact pathogen responsible, instead categorizing these as unspecified acute upper respiratory infections. Speculation among medical professionals suggests a possible resurgence or variation of Mycoplasma pneumonia. The situation is further complicated by a lack of transparency and declining healthcare access, particularly in rural areas. With national resources being redirected towards defense and security, the healthcare system's ability to respond to infectious outbreaks is under significant strain. This highlights a broader risk. When healthcare infrastructure is compromised or underfunded, the ability to detect and contain emerging viruses is drastically reduced, making localized outbreaks far more likely to spiral into wider public health emergencies. Another significant concern is the increasing spread of avian influenza, particularly the H5N1 strain. Over the past few months, this highly pathogenic bird flu virus has been found in poultry, wild birds, and now dairy cattle in several U.S. states. The detection of H5N1 in cows marks an unusual and alarming development, as it suggests a potential expansion of the virus's host range. Infected cows have shown signs of illness, and in at least one confirmed case, a human exposed to the infected animals contracted the virus. Although human-to-human transmission has not been confirmed at this time, experts caution that the virus's ability to mutate and adapt could change that scenario rapidly. What makes H5N1 particularly dangerous is its high mortality rate in humans, combined with the possibility of silent spread among animals before detection. Public health officials are calling for stronger biosecurity measures on farms, enhanced surveillance of livestock, and investment in next-generation flu vaccines. They also stress the importance of international cooperation and data sharing, as the virus does not respect borders and can spread through migratory birds and global trade routes. Taken together, these 5 developments, measles in Australia, Mpox in Europe, norovirus outbreaks at sea, respiratory illnesses in Russia, and avian influenza in livestock, paint a clear picture of the challenges we face in viral containment and prevention. The world is no longer in a reactive mode. We are in a constant state of readiness, where emerging diseases can quickly turn into global health emergencies. Experts urge global leaders not to repeat past mistakes of waiting too long to act. Preparedness is no longer optional. Investment in public health, transparency in reporting, and rapid deployment of medical countermeasures are essential components of a safer future. Public awareness also plays a key role. Understanding how viruses spread and the role of vaccines, hygiene, and healthcare systems in mitigating outbreaks empowers individuals to take meaningful steps in their own communities. As we continue to navigate the ever-evolving landscape of infectious diseases, one thing is certain: viruses never rest. And neither should we.